My first experience, I remember turning up to emergency having suffered what I now understand as the panic attack. But at the time, it felt more like a heart attack. So that was a lot of chest pains and things like that. So my experience with it was that doctors and hospital systems, they were able to tell me everything it wasn't, and briefly mentioned, oh, maybe it's anxiety, but then discharged me without any follow-up care, without anything. We know our body and our brain better than anybody else, and we know when there's changes. And I think by putting us at the forefront and giving us the rights that I believe we deserve, it puts us in control. I'd like to think that we're in a day and age where we're not being told what to do, how to feel. So I think it's really important that each individual is validated based on their own, own experiences. I think there needs to be more people with lived experience in certain roles within the hospital system. I believe that there needs, for starters, there needs to be a better way to get through the emergency doors than there currently is. There needs to be a mental health triage. That is something I'm quite passionate about. There needs to be a more calming entrance into the hospital. And, when it does come to hospital treatment, and this kind of links into rights as well, a lot of people are stripped of things, whether it be their phones. That's quite isolating. Their rights are taken away. They're told what to think and feel. It's very quick to medicate and keep someone, as a manner of de-escalation. I think there needs to be more non-clinical spaces within a clinical environment, because you still need those clinical supports, but people want a more calming space to be in that helps them de-escalate, to be able to unpack what's happening for them. Using my lived experience in a way to empower others has been quite validating in my own journey. It's given me a space, I think, to ensure that those that go with me or after me have a clearer pathway, because in those moments when you're experiencing all kinds of distress, you need someone that's in your corner, that's walking alongside you. You need someone that's going to advocate. So it was really important for me to be involved. Sometimes in those moments, those people don't have a voice or don't know how to find their voice. And they need to know that they do have rights, even though they live with mental ill health. They have rights like anybody else. There's a great deal of empathy for people that have cancer or are going through those sorts of treatments or have diabetes and those kinds of diagnoses that they live with all their lives. But when it comes to mental health, there's still so much shame and guilt. Yes, we've come a long way, but we've got a long way to go. So I would really like to see in a perfect world, it be more broadly accepted. And by that, I think there's, newspapers and our media play a very significant role in that, as does the government. I'd love to see just purpose-built mental health hospitals that don't mean it's either private or public. I think it shouldn't have to come down to money when people want to access adequate care, that they should be able to get the beautiful settings that private patients do. When you are at that crucial point, hospital is often the only place to go. So I believe there definitely needs to be a different entryway. You should be able to, when you're in heightened distress, be able to access the hospital. So that would be my perfect world, is to have all these wonderful places pop up that are non-clinical, but with clinicians involved, that involve a whole circle of people, wraparound supports and retreats and things like that people can go to, rather than waiting till it gets to crisis point. I remember going through one of my worst times. The hospital system weren't the best, and because of some of my symptoms were dizziness, I was referred to a neurologist. And I remember sitting down with my neurologist, and he went through everything and said, look, your scans are all clear. And rather than then just shutting the door and going, look, it's nothing for me to deal with because everything's clear, he then just looked at me and said, talk to me about what happened that led you to go to hospital. Tell me what happened around the birth of my son. He actually unpacked it a little bit for me. And that's when he first said, this sounds like a panic attack and it sounds like an anxiety disorder. And here's the name of someone you can go to for mental health supports. But until you can get an appointment, here's some medication that may help, but you really need to talk to someone. And I often say now, if I could go back and thank him, I would, because he turned my life around. He kind of gave me hope that I could get through it. It wasn't all helplessness.